You're listening to the Unfixed podcast.
I really turned to art as an escape and as a distraction. But as I started to paint and to draw, it unlocked an internal language and a place of escape, honestly, in a place where I can bring my vulnerability and my hopes and my fears, and I can process them and put them onto a canvas or on the dance floor or into a poem. It gives language to things that I wouldn't otherwise be able to process. And through that, I've just have found a voice really within me that is very powerful. And it's a way for me to tell my story in such a creative way. And I just realized that if this can bring me through some of the darkest moments of my life, I want that for other people.
Hi, everyone. This is the Unfixed podcast, and I'm your host, Martelle Catalano. The chronic illness community often talks to each other, but in this show, we open the dialogue, exploring adversity through different walks of life to recognize our shared humanness. These intimate conversations are between people who are creatively contending with diverse challenges. One person has a chronic health condition, because they're often experts in facing the hard stuff. The other is a professional working within a relevant field or facing their own unique battle. Each episode is an invitation to lean into curiosity and compassion while recognizing that we can live powerful lives despite, or sometimes because of, our circumstances. This podcast is part of a suite of resources provided by Beyond My Battle. If you feel inclined to support the show, you can do so at beyondmybattle.org/donate. That quote we opened with was from Rachelle Alford. She's a subject in the award-winning video series called Unfixed. Rachelle's also a survivor through many walks with adversity. Poverty, violence, homelessness, and multiple forms of neglect and abuse defined her childhood. Rachelle became a mom at 18, but her desire to live beyond her circumstances screamed louder than the barriers set before her, so she became an ER nurse in 2013 and thrived serving others in the chaotic environment that comes in that setting. But in 2018, after a 3-day cruise with coworkers, Rachelle developed the debilitating condition MDDS, otherwise known as mal de débarquement syndrome, and was forced into early retirement. She spent the last 2 years learning how to redefine and re-love herself. Through this process, she's discovered an unshakable inner strength and voice, and she expresses it through dance, painting, and writing her first memoir. Developing her creative expression and sharing her story with others is bringing her back into the land of the living and the thriving, she says. Rachelle is currently developing workshops that will help others heal through creative expression, transforming ashes into artistry while learning healthy coping mechanisms. And today, we're excited to hear Rachelle share a conversation with another beautiful human being who has devoted her life's work to reclaiming the power of patient stories in healthcare. Dr. Annie Brewster is an assistant professor at Harvard Medical School and a practicing internist at Massachusetts General Hospital in Boston. She is also a patient, diagnosed with multiple sclerosis in 2001. In 2010, motivated by her belief in the power of stories to improve health, Annie started recording patient narratives. Over the years, her finished audio stories have been featured on Boston's local NPR station, WBUR. In doing this work, Annie has seen firsthand how the process of storytelling is in itself therapeutic, both for the storytellers and the listeners. Research supports this claim. Health Story Collaborative, the 501c3 organization Annie founded in 2013, grew out of this work. She is committed to keeping the patient voice alive and to reclaiming the power of stories in healthcare. Annie's work has been published on NPR.org, the New York Times Well blog, and the Boston Globe and MS Focus magazine. She's been featured in Harvard Medicine magazine and on the cable television program About Health with Jeanne Blake. She's also presented at TEDx Fenway in 2014 on harnessing the healing power of stories. Together, Annie and Rachelle are here with us today to share a rich, open-hearted conversation about how we can draw strength from sharing our stories of adversity, particularly those with chronic health conditions. Rachelle and Annie, I'm so happy to introduce you two to each other.
Thank you so much. Thanks for having us. Rachelle, it's really nice to meet you.
Very nice to meet you too, and it's an honor to be here.
Oh, thanks so much, you guys. Integrating an illness into your identity is a process, and one that takes time, self-love and patience, all of those things. But most fundamentally, it's a process of meaning making. What is the meaning you're drawing from your own health narrative at this point?
Wow, well, that's a big question. And that is like sort of the essence of what I feel drives my work. It's this question of identity and integration. And I guess I'd start by saying that it's an ongoing process. I don't think it's ever finished. So I can't really say sort of what am I drawing from it at this very moment. But for me, the recognition that my identity shifted so drastically after I got a diagnosis of multiple sclerosis was really surprising to me. I've been working as a doctor, and I'd never really thought of that before as a doctor, that, you know, you deliver a diagnosis to a patient, and then as a doctor, sometimes you think that's the end of the story. You sort of solve the mystery and it's over. And in fact, for the patient, it's really the beginning of a story and a major identity shift. And I didn't really understand that as a doctor until I lived it as a patient. And I think I understand it more clearly retrospectively, but I see how it was happening for me, that I had sort of a really major identity meltdown when I got that diagnosis. And for me, that meant sort of going into denial for quite a long time. I sort of lived in denial for like 5 years because I just couldn't fit it into my narrative of self. I'd sort of thought of myself as someone who could like always overcome any obstacle just by like determination and brute force and will. And so it was really like hard for me to accept that I had a diagnosis of a disease that had no cure. And what did that mean? And so learning to tell my story over time really helped me to integrate that part of myself after I really rejected it for a long time, which was a painful place to be. And I think that integration is key. I have a lot more to say on that, but I'd love to hear Rachelle's take on it first, and then we can talk more about it.
Well, I want to start by saying, Annie, I spent several hours researching, and I'm just so incredibly inspired by you. So I prepared for this question and wrote it down just because my thoughts are kind of scattered a lot. I was watching an interview with a Holocaust survivor recently, and she said something that really resonated with me. The worst conditions can bring out the best in us. This is the most fundamental principle of my own health journey. I've often equated many of my experiences to the process of the refiner's fire. Metals like silver and gold go through a purification process by fire to separate the impurities that rise to the surface and are scraped away. The journey I'm on to find healing in every way possible is one that at times is painful, but necessary. But I travel it knowing that what it's producing is pure and valuable and absolutely a necessary part of my story. Every single moment of our lives has meaning and serves a purpose. It's my choice what I choose to do and how I choose to see these moments. So I relinquish control over to the process to allow it to teach me, grow me, refine me, and ultimately be used for greater good. It's been a long and hard road to find the place that I'm in now. Had it not been for these health struggles, I would most likely still be stuck in the cycles of perfectionism, people-pleasing, self-hatred, and still avoiding mending old wounds. The past 2 years of fighting for my health has taught me I'm worth fighting for. And the journey toward healing is for so much more than just my physical health. It's a weighty and, let's just say, complicated exploit, but the view from the top will be extravagantly redemptive.
I feel like one thing that the two of you share that I'm hearing, which I know a lot of people in this world share, is like this perfectionism mentality pre-diagnosis. And what was that like for you to be this like perfectionist type person and then receive this diagnosis of something you couldn't fix? And is there meaning built into that? Like, is there meaning like that you were a perfectionist then, and perhaps the meaning of all this is to relinquish that perfectionism?
Definitely. Like Annie said previously, that you kind of hit this identity crisis when this happens. And I had based all of my worth on what I could do and what I can do for others, and titles like nurse, mom, wife. And I didn't give myself very much grace. I'm an overachiever. And so I always felt if I wasn't overachieving in all of those areas that I wasn't of worth. And so this process, because I literally overnight lost control of every aspect of my life. And I had a death grip on every aspect of my life. And it was really dark there for a while. But through this, I've learned so much about where my hope and where my trust lies. And it's not in what I can do for other people or my skills or my abilities. It's truly just about who I am as a person. And so I've learned to love myself instead of always operating out of a place of fear of rejection, really, in so many areas.
That's beautiful. That resonates a lot with me as well. And for me, it was really like I felt ashamed at first of getting a diagnosis because I felt sort of broken and flawed and angry at myself almost, which I thought was, again, I would never, like as a doctor, I would never think of my patients that way, but I directed that at myself. And for me, I think the meaning came slowly, but learning how to find strength in that brokenness and find new perspective and not gloss over the hard parts, but be able to frame my story in a way that allowed me to articulate the strengths and the shifts that had given me new perspective and new empathy, and had, taught me how to be a better doctor, and had actually taught me how to be a better parent and friend and spouse and all of that. And for me, that was about learning how to tell my story and sort of realizing slowly over time that, we can't control what happens to us always, but we can always control the meaning we make out of what happens to us. And that is where storytelling really comes in for me. And for me, that is sort of the point of empowerment, that we have control of that always, of how we are going to move forward in the face of challenge. And that's not easy by any stretch, but I sort of came down to what's the alternative. I can sit around and sort of be mad at myself and ashamed, or I can try and figure out how to make this a part of me and use it in a way that can help me and can help others. And I think in the helping others, I really found strength. And in learning how to bring it into my work as a healing professional, my experience could be useful in that way. And that was giving me a sense of agency and helping me to move forward and really accept and integrate it. And that's really the meaning that I found, I'd say.
Annie, I read your blogs and I watched your TED Talk, and you said something that was it put into words what I was starting to discover through this process as being a healthcare professional and a patient. And you said the system, did not support human connection. People became a body part versus a human being. I saw that so often, especially in the field that I worked in, emergency medicine, where the concept of patient care is treat them and street them. And it really took the humanity out of the experience and away from that person. And to hear you say that as a doctor, and to realize that part of the healing process is truly sharing the story, and you providing a space for story sharing and creative expression for patients. I know through this process over the last couple of years, that really has been what has held me and given a language to the things inside of me that I couldn't necessarily verbalize with words, but I could verbalize through movement or through a painting or a poem. And that is where I found so much of my healing, and so much of the breakthrough that I've experienced over the last couple of years is through that process of storytelling. Our stories of overcoming and living and thriving unfixed and human are written to be shared. And personally, the more that I share, the more I'm able to see the grace, love, and mercy infused into every fire that I've ever walked through. I see hope. And I know that that's something that you are bringing onto your platform, is hope. And that hope carries me, because I know that ultimately that's how my story will always end. And there's a lot of hopeless people that are walking around, especially right now, that need to know the hope that we carry, and that need to see the humanness of all that we are, so that they can give themselves permission to be human too.
Yeah, that's so beautiful, Rachelle. And it's so true. I really found, like, when I was first diagnosed, before I started sharing my own story even, and I was feeling really private, and I really only told my closest friends and my family about my diagnosis, I found myself seeking stories. Like, I really wanted to hear stories from other people, because in that sharing that is ultimately helpful to us as the sharers, it's so much of a gift, I think, to the listeners. And because it's sort of like you hear a story from someone else expressing their vulnerability and sharing that, and it's like you're able to take a huge sigh of relief, and everyone feels freer. And so it breaks down those barriers and it connects people. And when I was feeling really sort of in my private, ashamed space, I just wanted to hear examples of other people. And that was sort of the first tickle in my brain of wanting to start Health Story Collaborative, because I couldn't find those stories really at that time. This was, in the early 2000s, that were sort of stories with a full arc, and the hard parts and the good parts, and the not cure, not necessarily everything's peachy, but, that there's still hope, as you said, that there's a way to move forward, no matter what the hardships are. Even in the face of a terminal diagnosis, sometimes there can be hope of healing relationships, or hope of doing things you have always wanted to do and are suddenly more motivated to do, or whatever it is. There's always a way to find that hope. And I think that's really important. And that's what motivates me too, is to try and give people that sense of hope, both in sharing their stories and also the opportunity to listen to other stories of hope, and like the shared humanity. And a lot of that is sort of the vulnerability that we all have, and opening up to that. I think it puts everyone at ease and makes us all feel like we can just be more human, be ourselves.
I want to just butt in really quickly, because I think it's important to sometimes just talk about the less pretty stuff involved in this. And I'm wondering, Annie, and maybe Rachelle, you too, from an ER perspective, I'm hearing all this about stories and like how wonderful it is to read stories. And my personal experience was that I did not want to read stories at the beginning. Like I find myself sometimes pushing away people's healthcare stories because it's too much. Some people just, don't want to listen to this stuff. Like they push this away. It's uncomfortable. It's really uncomfortable. Like to think about someone with a life-altering disease or a life-threatening disease or death, even to even talk about that or read about that is like, why would I want to go there? Why would I want to put myself in a position to do that? And I guess the question that's burning in the back of my mind is why do we feel that way? Why do we push this away? And then secondly, like, is it the system that is preconditioning the doctors to not want to hear the stories or not have time to hear the stories, and therefore the patients don't feel like they can share?
I have lots of thoughts on that. And Rachelle, I'd really love to hear your perspective as an emergency room nurse, because that is, as you said, such a fast-paced environment, and there's really not a lot of time for listening. No, I mean, a lot of, why I started Health Story Collaborative came out of me trying to address what I feel is broken in the healthcare system, and I'm seeing that from both the physician side and the patient side. It is incredibly broken. To me, I'd say it's more a time factor than that providers don't want to hear the stories. I mean, I went into this field because I wanted to hear the stories. I actually did 2 years in psychiatry, but I sort of missed the hands-on piece, so I went back into internal medicine. But it was the stories that drew me. And primary care, I found so heartbreaking because you just don't have time. I worked in a women's health center. We had 20 minutes to do our full physicals, and that included sometimes a pap smear, dealing with diabetes and depression and high blood pressure. And you just didn't have time, and you had patients scheduled throughout the day. And so I think it's a systems issue more than a provider issue. I think most providers really want to hear the stories. But, the studies show like we interrupt patients like on average of 11 seconds after they start talking. And a lot of that is a time issue. We don't have time. So I think that's heartbreaking. Would I say that patients have been conditioned to not want to tell their stories because of that? I don't think so. In my work that I do sort of outside of my clinical job with Health Story Collaborative, I find that patients are just so hungry to share their stories. And it is so empowering to them to be able to do that. People, I find, usually are more motivated by thinking that their sharing is going to help somebody else, which is true. People aren't usually drawn to do it because it's going to help them, but of course it does. But it's that wanting to give back and wanting to find agency in this thing that's happening to them that they don't have control over, and make something good come of it by helping other people. So I think people are really hungry to share their stories, and I think they feel very frustrated. I feel very frustrated as a patient sometimes. So I think the system is broken, but I still think people really want to have that time and space. The sad truth is I feel sort of depressed about the system because I don't think it's going to change anytime soon. I do feel that in my work, I'm able to tune into the stories to some degree, but there's still limitations. And Health Story Collaborative is really about creating some sort of space outside of the clinical exam room to make that happen. And I think we have to intentionally do that. And in fact, when I started it, had to step outside of the hospital to even get it off the ground because there's so much resistance and red tape and sort of risk management framework and concerns about litigation and concerns about patient privacy. So there are all these sort of systemic issues that shut down stories because of fear in some ways. So I think I had to step outside to really create that space for it. But I'd love to hear, Rachelle, more about your work as an emergency room nurse. How did that coincide with your diagnosis? Or how do you think that played out, your experience as a provider when it came to you then being a patient?
Annie, I do have to agree with you that a lot of it is that the system is broken. Working in the ER, administration would put, certain things in place that make it virtually impossible for providers to connect with their patients. We had metrics that we had to meet about, the time from the time that they walk into the door till the time that they're admitted or discharged. It was like the faster the time, the better in the eyes of administration. And so that the system is definitely broken. And I think especially in the ER setting, and it's sad to say, but I witnessed it personally with doctors and nurses is that you tend to get jaded after a while of seeing the worst of the worst. And also, there is some mistreatment that happens to providers as well, especially in that setting. And so, from what I saw, my own personal experience watching and being a part of the system and watching the doctors was, they were trying to meet those metrics. Some of them were jaded. And especially when people would come in with chronic illness, it was often an attitude of, why are you here? And that is heartbreaking. And it bothered me even before my own health journey. It bothered me. But after becoming sick, there were some moments that I reflected on as a nurse where I should have been more empathetic and compassionate, because people come in to the ER and 10 out of 10 times they're scared and they're terrified and they just want someone to see them and hear them and take the time to hear them. And unfortunately, I would say at least 50% of the time, it was how quickly can we get you out of the door or into a room, and we're just going to do the bare minimum. People in that setting become just so hyper-focused on the critical patients, and when the non-critical patients come in, they don't get the ear and they don't get the complete attention of the provider, because that provider is thinking about the person next door who's critical. And so there is a really big gap for people, especially in that setting, that are dealing with chronic illness and disabilities.
100%. And I think a lot of it's economic, right? So the hospital is really a business model above all else. So that's driving this sort of numbers. You want to get the numbers in, quicker is better. But then there is also the acuity, like you said, that you have to worry about the critical patients. When you were speaking, I also was thinking about sort of how we define healing. And I think this is part of medical training, that we're sort of trained to think that it's like synonymous with curing, rather than sort of healing. And how can we do that? Like, if we can't fix it, can we still heal? And absolutely, yes, we can. But I don't think we're trained to think that way in healthcare. And so I think doctors can sometimes feel, I say doctors because I'm a doctor, but providers in general probably can feel powerless sometimes when we can't fix it, because that's sort of the mindset we've been trained in. Instead of reframing that and saying, like, how can we be with this person and see them and hear them, as you said, and just give them a healing space, that can do so much good. And maybe that's all they need. And we don't think that way. And I think that also, because of all of the things we've been talking about, leads to a lot of provider burnout, right? Because the meaning making for them has been stripped away. I certainly have felt that as a provider, like in primary care, that you don't get those stories and you're not connecting with people deeply in the way that you want to. They're calling that now sort of moral injury in healthcare, that there's this moral injury that's sort of leading to burnout and fueling this whole burnout epidemic in medicine, where providers really are missing those connections because of the structure of the system. So it's not working for patients and it's not working for providers. And so, yeah, it's broken, definitely.
I have a question for you, Annie. When you recognize the social justice issues that the chronically ill face, and you wanted to harness your platform as a provider and your personal experience as a patient, how did you begin to tackle such a huge need while also navigating the overwhelming reality of your own health struggles?
Well, I tend to be a little impulsive, which has worked for me mostly in my life, but just in terms of I'm a leaper. So I think I just kind of took a leap and said, I'm just going to start doing this. And so I just started collecting the stories at first and just creating a space for that. And I got someone from radio to come train me in how to do the equipment, which for me was honestly the most anxiety provoking piece. It's just like the audio editing and the technology part of it. And I just hired someone to come help me do that. And then I just started doing the stories. And then I learned a ton just in doing that. And it just sort of fed itself and built on that. And I'd gone into it thinking, I'm going to create this listening library for people who want to listen to stories. And then I learned so much from doing it that just like creating that sacred space for someone to share their story and guiding them through that process. And then, editing it and reflecting it back to them and having them share it and be witness in doing that was so therapeutic for the person doing the sharing. And then that just snowballed from there and became Health Story Collaborative. But I do need to give a shout out to like my number one best collaborator at Health Story Collaborative is a guy named Jonathan Adler. He's a psychologist and he's our chief academic officer. And he's a scientist who studies the health benefits of narrative. And so I've learned so much from him. And like, honestly, at first I was sort of anti the science because to me, I was like thinking, we can't measure everything and not everything beautiful. We shouldn't try to measure it and contain it. And and in healthcare, because I'm a doctor, everyone was sort of like, where's the data? Where's the data? How can you prove this works? And I thought, this is just intuitively so right. And of course it works. But Jonathan Adler's research is really sort of what he would say is like bottom up science. So it's really starting with the lives of human beings and stories and how we tell our stories and how our stories promote health and looking for different themes that we can help people develop in their stories that are associated with health. But that's not really an answer to your question, except to say, I don't know how I found the time. I just sort of took a leap and I felt like it actually informs my clinical job too and just makes everything feel more meaningful. So like, I feel it's a gift to me. So I don't feel like it's a service. I feel like I find so much meaning in doing this work. I love it. And I feel like it feeds my soul. So it's good for me. But I would love to hear more about Ashes to Artistry and how that sort of evolved for you.
I've always have been a very artistic person, but I never really did much with it, especially in childhood. I wasn't really given the opportunities to do anything with it. And I found dance in college, and I had found so much more than just this principle of movement, but it was actually it gave a language to a lot of the things that I was trying to process. And so it started about 20 years ago through dance, and then in 2014 I lost a baby. I was just 12 weeks pregnant, but it was really life altering for me. And I got some paint and a canvas, and I painted this portrait of a mama and daddy bird on one canvas, and on the other canvas it was a baby bird. And there's so much more to it than just birds, but it brought some closure and hope and healing into that circumstance. And so that was the first time I had ever really painted, and I let that go for a while. And then a couple of years ago, I got sick with Maulde-Debarquement syndrome and vestibular migraines. And it's this constant feelings of just being really disoriented in time and space and your thoughts. And it's like living and walking through sludge, but like on a merry-go-round all at the same time. And so I was trying to find ways to escape that. And so I started dancing for one again and painting, and it would take me away from the places of torment for hours. And so I really turned to art as an escape and as a distraction. But as I started to paint and to draw, there was so much unlocked within me. I don't even have time to really go into all of it, but it unlocked an internal language and a place of escape, honestly, in a place where I can bring my vulnerability and my hopes and my fears, and I can process them and put them onto a canvas or on the dance floor or into a poem. it gives language to things that I wouldn't otherwise be able to process. And through that, I've just have found a voice really within me that is very powerful. And it's a way for me to tell my story in such a creative way. And I just realized that if this can bring me through some of the darkest moments of my life, I want that for other people. And so Ashes into Artistry is really about giving people the same tools that I have found to find their own voices and to find the beauty in their story. I really love abstract painting. I feel like abstract painting is kind of like a picture of my life. It can be so chaotic, but it's so beautiful. Yeah, Ashes into Artistry is very new and I'm still working through it. It's a place where I sell my art, but mainly I want it to be a place I write blogs, and I just want it to be a place where people can find resources and tools and workshops. I want to do virtual workshops too, just so people can process really and have a safe place to do that and fall in love with themselves and fall in love with the process and fall in love with creativity.
That's beautiful. I'm so curious because I often think about this, about different ways that we tell our stories. And right, we can do it in spoken word, through language, or we can do it through art. And I really believe that. But I'm curious, in your process, when you're creating an art, are you thinking about it in words? Like you have a narrative in your head and then you make a dance piece that comes out of that? Or does it just happen more spontaneously that it comes out of your body and you aren't necessarily articulating it in words? Or what's the interplay between the artistic medium and language?
I partner and engage with music that speaks hope, and I build my own hope into that through movement. So that's one medium, and kind of what I'm thinking there is I'm really meditating on the lyrics. And then with art, I'm kind of a prolific artist. I have so many different ways that I work through that, but I restore furniture, and clearly like I'm all into the restoration story. That's my life. And so that's kind of what I'm thinking when I'm restoring furniture. And then when I'm painting, sometimes I'm really digging into my imagination, and my imagination was something that I was robbed of when I was a kid. I didn't get to be a normal kid and imagine this and that. And so a lot of times I'm just escaping into a beautiful, peaceful place, and I'm just putting that place onto a canvas so I can reflect on it later.
Oh, I love that. I relate to that so much, Rachelle, and because I'm an artist. I have an undergraduate degree in studio art. So when I think about making art, there is like this zone in Taoism. Actually, it's called like Wei Wu Wei, and I use that a lot when I explain the process of dancing, art making, anything. I'm not a dancer or anything like that, but it really means like doing without doing, and you go into a place of where you're creating or you're doing, or even like some amazing athletes in the world are, they're doing their sport, but they're not really. It's an effortless effort. There's training behind it, of course, but when you're in the action of like running the race or doing the dance or painting, it is this effortless effort and doing without doing. And there is almost like, Annie, when you said like, are you thinking in words? Like, I know for me, no way. When there's like an art piece and you're in the thick of it. And when I am thinking in words, I'm like, this is a mess. Like those are the words.
I love what you said, Rachelle. I love what you said about accessing your imagination. To me, that's so healing that you sort of, you say like escape into it, but I also see it as sort of like an uncovering and digging out this piece of you that was lost because you had all this stuff on top of it that you've been able to clear away. That's, to me, really beautiful.
Oh, God, I feel like we could continue this conversation. I could listen to you guys talk, and it's hard for me to not engage with you both, obviously. So, but is there anything else that either of you wanted to kind of leave a listener with or ask each other before I wrap up? I
have one thing before my internet cuts out. I just, the story of trial and redemptions in our lives could be somebody else's survival guide. And so when we don't share our stories, we are not only robbing our own opportunity to look at our lives through a different lens and a different perspective, but it also robs others of the lessons and keys that you've learned through your process to unlock their own breakthrough.
Absolutely. I love that. I think that sort of so resonates with me, and, it's an opportunity to give back and help others. And for me, I feel like, the themes I just talked about, like I have been able, in doing that, find my own sense of agency and find my own sense of redemption. Like, okay, out of this disease, at least I can share my story, which is vulnerable, but it also might help someone else, as you said, their roadmap. I love that. I think the thing I would leave people with, just, as a provider, I think, well, first of all, I think I identify more as a patient than as a provider. But from that point of view, I'd say, like, the patient is always right. And I want the patients to remember that. And I really believe that we have to use our voice and trust our instincts and trust ourselves in our medical encounters. And as a provider, like, I really have shifted the way I practice since I have been a patient, in that I see myself much more as like a guide. And yes, I have knowledge that I've learned that it's my job to share, but I'm much more willing to sort of let people be where they are, instead of sort of think this is the treatment plan that we should follow, period. And so that can happen in medicine, that people sort of have the providers have sort of a vision of what they think is right. And sometimes I have had to push back against that as a patient. And I encourage people to just trust your instincts and remember that it's your journey and your story, and that you are right and you will decide when and what to do.
Well, thank you both so much for joining us, for your wisdom and really for your courage to share. Thank you.
Thanks for having us. It was really nice. And Rachelle, it was really nice to meet you and talk to you.
And thank you so much for what you are doing, and being, both of you guys, and being a voice out there that needs to be heard. So thank you for your time and your dedication to this community and just the world in general.
Thank you, Rachelle. You too.
Listeners can learn more about Rachelle and Annie by heading to the episode page on beyondmybattle.org or unfixedfilm.com. And I also want to encourage everybody listening to take that next step into sharing your story if you're feeling empowered right now. We offer weekly virtual support groups at Beyond My Battle, and that's a great way to start sharing your lived experience, your walks with adversity, or just to hear from others doing the same. So you can sign up for those groups at beyondmybattle.org under support. The Unfixed podcast is a collaboration between Unfixed Media Productions and Beyond My Battle, a nonprofit helping people reduce the stress of illness and disability. If you want to learn more about the Unfixed documentary, visit unfixedfilm.com or subscribe to the Unfixed Community YouTube channel. As always, if this show or particular episode resonated with or helped you in some way, please leave us a review or share with your friends and family.